The video you are about to see depicts donning and doffing of personal protective equipment for use in airborne isolation scenarios. These scenarios would include any resuscitation in the emergency department, which includes airway management or high flow oxygen. Anytime you were in the intensive care unit with direct patient contact, which includes all the patients who will be undergoing some type of airway or respiratory management, or any scenario in which your patient would normally be in a negative pressure room, but we do not have any available due to overwhelming patient surge. This video is not intended for use in modified airborne isolation. First, we're going to demonstrate the donning sequence, which means putting on the PPE. Since we are not using an integrated Tyvek suit in most settings, there is no need to follow a rigid "what do I put on first" flow diagram, since donning occurs in the cold zone where everything and everyone is clean. Since Robert will be demonstrating the donning sequence using an N95 mask so that he's able to hear what we're saying, the first step is to place a hair cover or surgical cap over the head if that is available. Next, he will put on operating room style disposable shoe covers if they are available and if they fit the type of footwear you are wearing. Next, put on your gown, tie it loosely in the back, and do not use the thumblets as they make it more difficult to pull the gown off when it's time to doff. Next, put on your inner gloves, followed by your outer gloves. Now we're ready to tape the seam between the gloves and the sleeves. 1-inch tape is fine. You're going to make approximately 2 wraps around the seam with the tape. And then you want to pull out some extra tape and create a tail by folding the sticky tape back on each other. This will make it easier to pull the tape off when you doff. Next, it's time for respiratory protection. Since it's too difficult to demonstrate this video with a PAPR, because Rob, as our subject, will not be able to hear what I'm saying, we're going to demonstrate the video using an N95 mask. If you're using an N95 mask, you then need to don eye protection in the form of goggles, safety glasses, or a face shield of some type. The key part to this final step of donning PPE is that you never ever go into a high hazard or hot zone situation with a respiratory driven pathogen without having your respiratory protection in place and ready to go. Now, Rob is ready to enter the hot zone. Now we will cover doffing of PPE. Stand next to the doorway or the exit of the clinical area. This is now a modified warm zone, although you are still standing inside a hot zone from a respiratory perspective. First, pull on the tape tabs and untape your outer gloves, but do not take the outer gloves off yet. Next, break the tie on your gown, then reach crosswise to each shoulder, pull your gown off of your neck, away from your body, off of your arms, making sure to keep the front or dirty part of the apron away from your body, and throw it in the trash can. You are now ready to exit the clinical area wearing your inner gloves. If you are wearing shoe covers, do the following. Open the door, lift up 1 foot, pull off the shoe cover, throw it out, and then step out into the hallway with just that foot. You are now balancing yourself. Then lift up the other foot, pull off the shoe cover, throw it out, and step completely into the hallway. If you are not wearing shoe covers, do the following. Open the door and ask an assistant to spray your soles and the entirety of your shoes with Lysol or similar substance as you step into the hallway 1 foot at a time. Do not step into the hallway with a dirty foot. You will need to balance on 1 foot at a time while your feet are cleaned. Your inner gloves are now contaminated as you have opened a door handle on the inside of the patient room, which is dirty, and you may have taken off your shoe covers. You're going to clean the inner gloves by using either hand sanitizer, or if that is not available, warm water and soap, cleaning your gloves for 20 seconds. Next, it is time to remove your respiratory protection. If you are wearing an N95 mask, remove the mask and throw it in the trash, unless there are specific instructions to reuse the mask, which at the time of shooting this video, we are not doing. Remove your eye protection and place it on the dedicated cleaning table. Remove and throw away your surgical cap or hair cover. If you are wearing a PAPR, you will unplug the cord from the battery pack, remove the battery pack from your waist, and place that on the cleaning table. Then you remove the PAPR from your head and also place that on the cleaning table. Next, with your inner gloves still on, use antimicrobial wipes to clean your eye protection if you're wearing an N95 mask, or to clean the entire PAPR unit, including the face shield and battery pack, if you were using a PAPR. Once you are done cleaning the eye protection and/or the PAPR, you are ready to dispose of your inner gloves by throwing them in the trash can. Pull them inside out, just like you would do if you were in the operating room or a sterile environment. Finally, thoroughly wash your hands and your forearms with either hand sanitizer or soap and water. And as a last step, to make absolutely certain that the bottom of your scrubs have not become contaminated since they were not protected by your disposable apron or gown, either have an assistant, or if you're sure the Lysol bottle is clean, you can do this yourself. You want to spray the lower half of your lower legs, front and back, with the Lysol type product. At this point, you are considered clean and the doffing process is complete.